I'm Terrie Cowley with the TMJ Association. On behalf of all of us, I want to thank the Facial Pain Association for your invitation to tell you about TMJ. We compliment you on all that you are doing to bring awareness to improve the lives of those affected by facial pain. We certainly feel a kindred relationship to you, which was begun in the 1990s when your founder, Claire Patterson, and I would commiserate together at NIH meetings. But it's even more than that. A 2021 article shows the large numbers of misdiagnosis of TN for TMJ and vice versa, showing we both have so much more to do to advance our respective science areas. Sandy Guilfoyle and I met through a short article Sandra submitted to the Milwaukee Journal about TMJ in 1986. Upon meeting, we immediately noted the need to find out as much as possible about this condition, and we organized a local support group, began exploring the TMJ literature to learn that there was no basic or clinical science underlying the treatments we had that resulted in harm. And we quickly heard from others that suffered similar outcomes. We incorporated the TMJ Association as a 501c3 in 1989. One of the treatments popular in the 80s was implanting Silastic or Proplast Teflon between the skull and the condyle. In 1991, the FDA issued a Class 1 recall on the Proplast Teflon material because of what they termed, quote, open communication to the brain, unquote, which simply means the material worked its way through the skulls into the brains of the patients. Our advocacy efforts resulted in a congressional hearing entitled "Are FDA and NIH Ignoring the Danger of TMJ Implants?" As you see, our advocacy work also attracted the Wall Street Journal reporter Bruce Ingersoll, who wrote this article. And at that time, it was the longest article, front page article published in the Times, in the journal. These experiences explain our passion to make the TMJ Association's primary goal to advocate for the best darn science this country has, and that it be directed toward TMJ. Our other goals are to serve as the resource center for the most comprehensive, credible information on TMJ, to promote awareness of the reality of what TMJ is like to experience, to provide support to patients, their loved ones through Inspire, an online platform, and by linking patients to each other, and receive empathetic support. We are proud of a number of accomplishments we've achieved over the years. We organized 8 scientific meetings, which were co-sponsored with the NIH. We have 22 years of consecutive congressional appropriations report language, directing the NIH to increase funding and quality of research toward TMJ, classifying TMJ devices at the FDA, attaining a GAO investigation on how TMJ devices got approved at the FDA, and many others. You can find a list of our achievements and much other information on our recently revised website, www.tmj.org. Two of our recent and very important projects are the TMJ Patient-Led Roundtable, which began in 2016 and will be ongoing. It is the first of its kind, public-private collaboration under the auspices of MD-EpiNet and with backing of the FDA and involving many TMJ stakeholders from the US and internationally. We started the roundtable with the need to find out why some TMJ patients improve with implant surgery while others worsen. It evolved into a far more comprehensive study of all aspects of TMJ and how they interact to affect patient outcomes. The goal is to establish a scientifically valid roadmap that can reliably predict treatment outcomes for individual patients. Currently, we are working on developing elements for the first TMJ patient registry. The other, through our efforts working with Congress and NIH, is the very first ever study on TMJ disorders. This was conducted by the National Academy of Medicine. The study covered comprehensively everything across all of TMJ, all the areas as were the recommendations which came forth from the study. The report accurately reflects the dismal state of TMJ and provides 11 recommendations which, if implemented, would incredibly improve this field. I will now turn you over to Chris Beasley, who is going to introduce herself, introduce the CPRA, which is an initiative of the TMJA, and also give you a primer of TMJ. Chris, take it away.